So good morning, everyone. Good afternoon and good evening, depending on where you are. My name is Luis Pinto, and I'm part of the Knowledge and team here at the GFF Secretariat. We very soon start with this webinar. In the meantime, technical requests. So for all of you out there in your countries, two simple things, please. If you can mute your mics while we speak, so that we make sure there is no noise in the background. And another gentle request, in order to facilitate the interpretation, we'd like to ask you to stick to your office language. So even if you are bilingual, please make sure you only speak the language of your office. This will make it easier for the interpreters to follow the communication here. We're very glad to have you all in this webinar. We know it is demanding sometimes to get this wonderful group of people together and join us at different time zones. We really, really appreciate that. It's a great opportunity to have you here. Today is a very promising webinar in terms of content, and I know many of you following the prep meeting, the liaison officers last weeks ago. We know it's an issue that many of you want to discuss, so we're more than glad to have Luke, Petra, colleagues from Nigeria here to share their experiences as well. With this said, I'll pass it on to Petra. And we'll,
Thanks, Luis, and good morning, afternoon, and evening, everyone. It's good to see many of you in a while. Some of us met. You can say hello. And if I may ask that if you're request, if somebody in the room can chair the meeting and can say who is in the room, that would be very helpful. Then we have a sense of who is actually there. So I will see Indonesia. Is anybody online? Indonesia?
This is from Indonesia.
Hi. Thank you for joining. I know it.
Hello, Petra.
Hi, Pinarto. Good to hear you. Thank you for joining.
Okay.
Do you want to introduce who's there?
We are here with in these rooms. There are several representatives from the government. I myself, my name is Pungkas. I'm from the National Development Agency, Bapanas, in Development and Nutrition. And on my right is Budia. She's coming from the Ministry of Health. And then Marco is the Employment Officers here in Indonesia. We have also here Representative Kulinda and Pak Arif from the Office of Vice Presidents. Joining us also in this place are Samuels and Elvita from the World Bank, as well as one of my staff who are in other places.
Thank you so much for joining us. I know it's very, very late there, so we very much appreciate you joining. It's very good to have you here. I hope you will I'm actually sure you will find this interesting, and I'm sure you also have to contribute to this seminar. Let me go to the other side of the world. Let's see if Rwanda is on the line.
Hello, Petra. Good morning.
Good morning, Kanut. How are you?
Yeah, we are okay. Yeah, we are with colleagues from Jakarta. Can you introduce yourself?
Hello, good evening or good afternoon. I'm Rieko Shibata from JICA Rwanda office. I'm program advisor of agriculture and nutrition sector. Thank you.
Hello, I'm Asinata Abela from Sun Alliance, Scaling Up Nutrition Alliance. Thank you.
Great. Thank you for joining us. We're happy to have you here. Let us see if Howie is on the line. Pius, are you there with colleagues?
Yeah, good afternoon, Petra.
Good afternoon, Pius. Good to hear you.
I'm here with a colleague from Ministry of Health. Others could be joining from their offices. So I think after Nick has introduced himself, we'll see who else has connected from their offices or from the place where a global fund funding request process is happening.
Hi everybody, I'm Nick Mandalia. I'm with the Planning Department of the Ministry of Health.
Great, thanks, Nick. And we heard from you the other day, so it's nice to put a face with your name, and great that colleagues are connecting. I know there is a big Global Fund event happening in Malawi. Let me move to Nigeria. Uma, are you on the line?
Yes, I am. Hi, Petra.
Hi, Uma.
I'm expecting colleagues from UNICEF.
Yeah.
Yes. Good afternoon, everybody. Petra, Luke, and Uma, and all colleagues on the call. This is Sanjana Bharadwaj from UNICEF, and I'm here with colleagues from UNICEF as well, Khalilu Mohammed, as well as Emmanuel Emedu. So it's great to be on the call. Thank you.
Thank you for joining us, and we look forward to hearing from you in a little while about the Nigeria experience. Myanmar, Chuchu, are you on the line?
Yes, Petra. This time I'm in Naypyidaw, another capital, and I have with me the UNFPA Assistant Representative.
Yes, hi, I'm Yin from UNFPA.
Can you hear us?
Yes, you are welcome.
And I have a Deputy Director from Maternal and Child Health.
Hello, I'm Nindele from Ministry of Sports.
Thank you.
Nice meeting you, Petra, and the team.
Great. I know it's very late in Myanmar as well, so we truly appreciate you have joined us for this session. Thank you. Let me see, going back to Africa, Sierra Leone. Stanley? I know in Sierra Leone there's also a big Global Funds proposal writing session.
Yes. Hi, Petra. This is Victor.
Hi, Victor. Good to see
You're
you.
a long-time friend. Stanley just, yes.
I'm just stepping in.
You're just stepping in.
Yes.
Petra, it's been a long time, you know. Yeah.
It has been a long time. Good to see you all.
Indeed.
Say who else is in the room for people?
I am here with my colleagues from the CSO Point, Health Alert, and the RMSH coalition members, RMSH GFF coalition members. They are here. I have Dartin John, Asan Conte is here, Mohamed Jallo, and Abu Karim Sankor.
So,
and the wonderful man himself.
So the other team from the ministry, they are not here because we have a donor conference in Kono tomorrow. The minister have invited a quite number of donors, so they excused themselves in being part of this meeting. But we also have a representative from the private sector and the missions. She's just stepping in.
Thank you.
And we're just, maybe once we sit, you get to see her. She's from the Christian Association of Sierra Leone.
Hi.
Great, you are welcome. Thank you for joining us.
Thank you.
Good to have you all here. I think you'll stay very interesting.
Yes.
Thanks. Let me go to Bangladesh. Farzana, are you? Victor and Stanley, can you mute yourself in the meantime? let me move to Uganda, because Farzana, we were not sure if she was able to join. Grace.
Hello?
Hello?
Hello, how are you?
Good, how are you? Are you, is it just you, Grace, or are there other colleagues with you? I can't see the room. And I also cannot hear you, so we may have a problem with the sound. I heard you for a minute, but then you were out.
Hello?
So, yes, Grace. Good to hear.
How are you?
Good. Now we can even see you all. Great. Do you want to introduce, or somebody wants to introduce who's in the room?
I can begin.
Yes.
We are going to be a big team. I've invited the Minister of Health, and lucky enough, we have Dr. Jessica Nsungwa, who is the government focal person for the GFF. We have Christine Mugasha from USAID. We are expecting more people from Ministry of Health who are coming. They are on the way coming. We have the private sector who is coming also, the private sector. The civil society organizations are also coming. Ministry of Finance sent apologies, they can't make it because of short notice. And the DFID will be on the WebEx. They will connect from the WebEx. Yes. I also am glad to report another officer from Ministry of Health, Dr. Richard Mugahi, has just arrived in. So we are just 4 now in the room, but 2 more are on the WebEx. One from DFID, another colleague from Ministry of Health.
Great.
Yes.
Thank you, Grace, and good to see you all. And Dr. Jessica, great that you are here too. And welcome to our colleagues from DFID online. Let me move to Burkina Faso.
Robert Kalbougou, officier de liaison.
I'm a liaison officer, Minister of Health. Nadine Kambura, Technical Secretary for Sanitary Development. Good morning, Yves Boudot, UNICEF, Health Specialist. Béatrice Cabouret, Advocacy, CSO, Nutrition. Théophile, Ministry of Health. Advocacy for Youth. Creme Hidalgo, CSO. Ouedraogo, representative of civil society, member of GTSM. Regis coordination for the financing of GFF. Abou Gilial, technical advisor and Minister of Health.
You are all welcome, and I can see Alain, your focal point is also on the line, so it's great to see you all here. And you're very welcome. We're very happy you are joining us. Let me move to... Hi, Alain. Good to see you too.
Bonjour, bonjour.
Merci.
Bonjour.
Good morning. Do you hear us?
Yes, we can.
Dr. Baye, coordinator of the mother-child mortality program. We also have here representative Minister of Health and a team in charge of managing GFF financing, various experts. We also have the GFF liaison officer, a representative of ICMS, and maybe some other people will come later.
Thank you. It's great to see you all, and it's good to see you, Martina. I'm very happy that you are here with your team, because I know you will also have some experiences to share today. Let me see, Central African Republic. Oscar, are you there with colleagues?
Good morning, Petra. Good morning, everybody. I have colleagues with me. I'm Executive Director of APREV, member of the Civil Society Platform, delegation of the European Union, and Director of the Sanitary Information System, technical advisor to the Minister of Health, François Leroux, national coordinator for the immunization and health system in Central Africa. I represent the civil society in charge of information and education in the Ministry of Women and Family. And other colleagues should be coming very soon. Thank you.
Thank you. It's very good to have you join. You're very welcome. We appreciate you being here. Let me see if Ivory Coast is here. Abidjan.
Oui, bonjour Petra. La Côte d'Ivoire est bien là?
Good morning, Petra. I'm liaison officer, and I'm going to give the floor to my colleagues. Director, Chief of Staff of the Minister of Health. I'm specialist in health for the World Bank. Technical advisor to the Prime Minister, Secretary of the Association of Health Groupings in Ivory Coast. Represent the private sector in health. Technical advisor to the Ministry of Social Protection. I'm in charge of preparing communication in the Ministry of Women and Child. With the Ministry of Health. From the Ministry of Health, in charge of the HIV program. Good morning. I'm here. I work at UNICEF. I represent the Minister of Health also. I am advisor, physician. I work at the Ministry of National Education. I'm from the Ministry for the Health of Women and Child. Advisor to the Ministry of Health, Ministry of Planning and Development, Ministry of Budget, in charge of communications. This is the Ivorian delegation which is going to follow the webinar.
Ambroise and colleagues, we are very happy to have you here, and it's great to see such a large delegation attending. I think you have won the prize today, so it's very good to have you all here, and I think you'll find this very interesting because it's all going to be about implementation, which is, I think, what all you countries are looking forward to or are already doing. So let me move to Guinea and see if, I see people in Conakry. Let's see if Conakry, who is there?
Good morning, Petra. We are connected with the platform. Good morning. I'm National Director for Family Health. My colleagues are going to introduce themselves. I'm head of planning at the Ministry of Health, in charge of family and children health. Minister of Health, I work in the family division. National Director of Nutrition in the Ministry of Health. I'm in charge of maternal health at the ministry. Technical advisor for training. In charge of planning and development, the Minister of Health. I'm consultant in charge of investment. I am in charge of IPPF programs. I'm specialist in public health at USAID, AID, and I'm the focal point. In charge of nutrition. I work at the Ministry of Health in charge of education and training. Work with the Minister of Health in charge of programs for youth. National Institute of Statistics. I'm in charge of the sanitary capacity building. I'm the coordinator of this program. Thank you.
Thank you, Freddie and colleagues. It's great to have you all here. We're very happy you are all connected and also able to share, I am sure, some of the experiences. Let me see, Port-au-Prince. Is Haiti on the line? Paul. Madagascar? Hasina, are you there with colleagues?
Bonjour, bonjour à tous.
Good morning. This is Madagascar. I'm a liaison officer of the GFF for Madagascar. We have had a small problem in the Ministry of Health. We have a new minister, a new general secretary also, and we have 3 GFF focal points within the Ministry of Health. One of them is the technical advisor. And unfortunately, he cannot be with us. And the other 2 focal points, I imagine, are also busy taking into account the changes we've had in the Ministry of Health.
When it comes to the participants today, I'm going to introduce them in general. We have representatives of the Ministry of Health for the national part. In other words, the Director of Family Health, then the Director of the Support Staff for universal health coverage. They're saying hi, but you can't see them. UCP is also represented. We also have representatives of this private sector. There's Marie Stubbs, and who represents the Association of Private Hospitals in Madagascar, the WHO. We have representatives of the Global Fund of HIV/AIDS, USAID, and HP+. So I think that I've mentioned everyone. Thank you.
Hasina, and it's great to see such a large delegation of attendance, especially if you have all these changes happening. I am even more impressed that all of you are there. So it's great to have you here and join us to share experiences and to learn from each other. So thank you very, very much. Let me talk to you about these seminars. Are really about sharing knowledge to improve operationalization of the GFF at the country level. The emphasis is very much on sharing experiences between countries, but I also really would like to encourage you that after the seminar, you reflect as a country platform on what does this mean, this implementation and what you heard and what you learned for your country, and what possibly what actions do you may want to take to improve operationalizing the investment case and the processes in country. So it's not just about learning from each other, but also really reflecting on what do you then do with that information in your country to improve what is happening. We will, after the presentation, we will give you a few minutes to prepare 2 questions or comments per country. To a question you may want to ask to the presenter, a question you may want to ask to one of the other countries, or maybe an experience you want to share from your country. with others. That is important. So please email these questions. If you're an English-speaking country, you email them to me. And if you're a French-speaking country, you email them to Joy. And then after we receive the questions, we will be able to answer all of these. So I'm very happy to ask Luc Laviolette, who leads the country operations, to present on implementing the GFF model in country.
Bonjour à tous.
Hello, everyone. I'm going to speak French, so I'm going to give you a few minutes to do this transfer. My presentation will be in French, but then there will be 2 countries who will speak English. So we'll use both languages this morning during this presentation. And as usual, you will use the language of your office to ask for these questions. So today we want to talk about the directive to implement the GFF model in countries. And these are guidelines that guide the national governments and the other stakeholders in the country. They stress the implementation stage. This is the stage that you're either starting now or that you've already started in certain countries which have made more progress. And then it gives you a guidance when it comes to completing the investment case. And as you know, that we have updated these guidelines. So we have these guidelines for the investment case to prepare it and then to implement it. And all of this is available on our website, on the GFF website, and you'll be able to get a paper copy from your liaison officer. This is a document which is a guideline. So this is advice that is given to the governments and the stakeholders. So we assume that you will adapt it to the country context. That's an idea, the fundamental idea of the GFF model. It wants to adapt to the priorities and the context of the country. And these guidelines based on experience when it comes to implementation. You know that there are countries who joined the GFF partnership 4 or 5 years ago. So these guidelines are based on their experience, and they result from a series of consultations with these countries who have more experience, and consultations also with new countries. And these guidelines will be regularly updated, and they'll be accompanied by a source books with country and global resources. This source book is being prepared, and it should be ready towards the end of April. I really want to stress that these guidelines are not certain things, because during the presentation, it's possible that you get the wrong idea. But I want to stress that this is not a list of requirements to be able to obtain or keep the GFF grant. No, this is advice we're giving to the countries. And it's not a list of documents that need to be produced. You shouldn't focus too much on this or that. It's a reference framework. And rather than being a list of very specific stages, it's a reference framework to allow you to think about this entire engagement. Here's a list, the outline of this document, and the elements mentioned in red are the elements we're going to talk about today. Obviously, you can ask questions about the other fields, but when it comes to the implementation, on the part of countries that have more experience than you. There have been major questions when it comes to the role of the country platform, what data is available for decision making, then resource mapping and tracking, implementation research, how to coordinate technical assistance, advocacy, and communication. And I wanted to stress also another fact, the transition you're going through now between the preparatory phase for the investment case and then a transition to implement the investment case. Sometimes this transition is difficult. And don't underestimate the challenge you will have during this transition phase, which might be going on, as in the case of Burkina Faso, or which will start pretty soon in other countries. And we'll be able to talk about these challenges if you want. So I'd like to talk about the national platform. I just want to remind you that it's led by the government. So the whole engagement, GFF engagement, is led by the government through a country platform and focal points. Countries are encouraged to use existing platforms. And I think that this is especially important during the implementation phase. You have to think about these existing platforms. This requires an effective participation from the following entities, and here I'm talking of the relevant ministries, at least Ministry of Finance and Public Health, but there are often other ministries included, and today there are other ministries represented in various places. Then you have the bilateral and multilateral partners, which give you financial and sometimes technical assistance. Then there's civil society and private sector. The bilateral partners are the financiers, but then in multilateral partners, among them you have the World Bank, etc. Very often what we see is that we encourage the countries to use existing platforms, and we note that the participation of civil society and the private sector is a little bit difficult because it's not always included, this participation of civil society at the beginning of the process. But during the implementation, during the preparation of the investment case, the participation of the civil society is more required, and especially during the implementation phase. It's important to notify all the stakeholders of what constitutes the platform, and this has to be reviewed and reconfirmed once a year. That's our advice. Once a year, you should review the platform, and you will soon receive a questionnaire to see how the different platforms work. This is an electronic questionnaire that you will receive and that will ask you questions on your platform. There's a tool that we've developed and which will be used in upcoming months in all the countries to try to get more details when it comes to the GFF engagement of the platform. There's an important aspect of this platform, which we noted. It's not only a single committee. During the phase to prepare the investment case, it's very often a committee which prepares the investment case. But during the implementation phase, it's more a coordination system. So you have a committee for coordination, but sometimes there are subcommittees on data, a subcommittee on the funding of health, or a subcommittee on technical aspects, etc. And what we see in the countries that are now totally in the implementation phase is that they had to think about what composes their platform. And often it's not the same membership than during the preparation phase. What you're seeing here is an example now. This is not necessarily the fields that you're going to choose, but I just want to stress that it's important to establish an implementation plan. So your investment case is generally fairly abstract, and so it's not possible to actually carry out the implementation. So you have to transform it into an investment or an implementation plan. And very often what we see in the different countries is that you have to link the different implementation plans that exist. So if you have different sources of funding for different projects, you have to make sure that all of these implementation plans are coordinated. So here's an example. It's not the document as such which is important, but it's more the coordination that can take place thanks to this tool. One approach is to use a scorecard which is balanced, and I chose 4 fields, but you could choose other fields. The important is to get a good balance among these fields. Very often, people stress the implementation. Above, on the right, you can see a package of services for RMN CAHN. It's important to have the implementation of this package, but at the same time, you have to have the reforms to strengthen the key system. And so you have to balance the two. And also you want to balance this with technical assistance to support both the implementation of the service package and the reforms. And then there's the whole issue of advocacy and communications to promote reforms, to have better communications during implementation, etc. So these are examples you might choose. You might choose other fields, but what's important is to balance the different elements that exist in the investment plan, and to follow the implementation, have an implementation plan that takes into consideration these different elements. And there are countries now which are harmonizing all the monitoring process. They have harmonized policies, etc. So you have also administrative aspects which need to be harmonized, but which could be included in the implementation plan, because these are not necessarily aspects that will be, or goals that will be reached during the beginning of the implementation. We're going to go now to the Liberia example. Petra is going to make the presentation, and she will speak English. But you're going to see the activities in Liberia.
The Liberia example I'm sharing here is a summary of several implementation plans coming together. What we see in many countries, when you start implementation of the investment case, you do not straight away have data to really see how or if things are moving in the right direction. That usually takes a little bit of time. But what is really critical is to make sure that what was proposed to be implemented is actually implemented, because otherwise the results will never show. So in Liberia, what the country platform has done is really look at the main activities that are part of the different strategies to implement the investment case, and to look, is there is this being implemented? So I'm giving an example here of priority investment area 1. They have 4 priority investment areas. And this is very much focused on comprehensive emergency CMOC and BMOC care. So in this area, they have different 4 different priorities identified under this strategy. The first one is around infrastructure and equipment, the second one on training, the third one on mentoring, and then the fourth one about health worker motivation to stay after hours and weekends. So during the bottleneck analysis they identified these were the main things that needed to be addressed in Liberia in order to improve maternal and newborn mortality. And what you see here is the 6 priority counties that have been prioritized in the investment case that are focused for really putting enhanced effort. And you see which agency is implementing which area and whether the whole county has been implemented or not. So you can see green shows no gap, and then orange shows that there is a gap across some facilities. So it's implemented in the county, but maybe not everywhere the infrastructure or the training is happening. And then the red is very clearly where the gap is. So this has been helpful for particularly the deputy ministers. When new donors come in, it's very clear where the gaps are. So the red, of course, very critically shows what is happening there. Now, underpinning all of these are implementation plans for each of these areas that have much more detail. But this sort of gives a very quick view for the country platform to look at whether it's working or not. Now, very often these are existing plans of different partners that are aggregated that then create a master plan or an integrated plan rather than everything being very, very new. So this is one example of how Liberia at least has dealt with getting a good sense, is implementation actually happening around the activities that were proposed. Thanks, Luke.
Merci. Merci beaucoup, Petra.
Thank you very much, Petra. We're going to continue in French. I want to stress the importance of focusing on monitoring activities during the first phase of the implementation, and then you're going to monitor results. But there's a year or two, a period during which you won't really see results, and this is a period of risk based on the momentum you created when you prepared your investment case. That's true in all the countries. Very often you have a lot of momentum when the investment case is prepared, and then everybody wants to go to implementation. But there's a period of a few months or 1 or 2 years where the platform has trouble focusing on a common objective because an implementation plan has not been prepared, and so the platform doesn't have a tool to follow activities, so to follow all the activities. And then there's a phase where you can start monitoring results, which is the most important. So now we're going to spend more time to talk about using data. This is really at the heart of my presentation for the implementation phase. During the implementation phase, that's really the main role of the platform, is to guide performance. And we do this by using data. We saw that the countries which were most successful used performance-based dashboards at the national and at the subnational level. And we'll see the example of Nigeria. You'll see how they use a dashboard at all levels we're in favor of standard indicators, but also specific indicators for the countries. One of the lessons we drew from the first years of implementing the model is that some countries find it difficult to really give priority to the results framework in the investment case. Sometimes it's difficult, since this is collective work, to get to a series of high priority indicators. And so we're in favor of really establishing a priority among the indicators. And really what is essential is to have a dashboard and with priorities. And so you have a series of priority indicators, and this is an approach which makes it possible to support this priority. Obviously, your dashboard has to be based on the theory of change in the investment case, and it can change with time. At the beginning, it looks more at activities, and later it focuses on results, and results that get more and more complex as time goes by. And it's a combination of routine data and survey data. It's also important to link financing to results. When you have your discussions, you'll be able to talk about how the results are in line with funding or not, in which case you'll have to have discussions to see how you can best use these funds, and see if there's also maybe other possibilities of funding. And this is the opportunity to strengthen the data, the national data system in your country, including CRVS. Then some other advice when it comes to the use of data. These are principles that you as a country should think about. So the data should include health financing, health system strengthening, and the outcomes of RMNCAHN. So this is a combination of these three types of data: health financing, system strengthening, and the package of services. Obviously, you need to have data which are high quality and highly reliable. I know that everybody's working in this field, but you have to continue to improve the quality and the reliability. But it's important to be accessible and available on a routine basis, that this data be accessible so that the platform can meet and have discussions and also make decisions if necessary. And the data must be cleaned and analyzed, curated and interpreted, etc. We advise countries to prepare a plan to use these data. We can talk about it more if you want. And as I was saying a while ago, it's important to have a subgroup which works on analyzing data, preparing a dashboard, etc. that can be used by partners. That's one of the lessons we drew from countries that have been implementing for some years now. Very often, this data is weak, and we're thinking about how to better support the countries in that field. And we often say, and I'm going to repeat it, that the GFF is a partnership. It's not only the secretariat of the GFF that supports you. So that's why we wanted to give you the example of Nigeria, where UNICEF and other partners are supporting the Nigerian government in this field. We also, within GFF, support the in-country initiatives to strengthen data systems, and when it's necessary, you can have polling of households, or when it comes to services. At the beginning of the process now, there's an exchange of letters which takes place, and these letters ask the government and the partners to share data. Then there's an annual review that should take place, which is more comprehensive than your usual meetings. And then some countries have annual results, an annual results conference, and so they look at the investments and but annually there should be a conference that looks on results, and that can draw lessons of the results obtained from operational research, and this can lead to change within the country. And then the countries are encouraged to have a midterm review, which is a little more comprehensive. And then the 4 pioneer countries which joined the GFF 4 years ago, for instance, Tanzania, find themselves in a phase where all the analysis of the data they did prepares them for the evaluation process that will determine if the country will get another grant from the GFF fund. So this is never guaranteed, and the evaluation is based strongly on the data coming out of the country, and to see what results were obtained and what the process was. So if there's so we can see how to use the data during the implementation phase. That allows the country then to be prepared for the evaluation, and therefore to increase its chance to have a new grant.
Quelques principes sur
A few principles regarding developing standardized routine data. Of course, we have to monitor the program and give an overview of the performance. It's an intuitive display which helps managers to make sense out of the data, analyze quickly the information in order to turn them into action. We also have to identify challenges and best practices. We have to identify bottlenecks, and the dashboards are only effective when the end user can refer to them. So the health workers during training, who not only report data, also have to be able to draw lessons. And those dashboards are of the utmost importance. And we'll see how Nigeria has used them. I'm now going to give you the example of Nigeria. Dr. Santana Badwas, who is the Director of Health at UNICEF Nigeria.
Thank you very much. And it's a pleasure to be presenting on behalf of the Nigerian team. Apologies from the Federal Ministry of Health, who wasn't able to be here. So as shared earlier by the earlier presenters, we've been working with the government, particularly the Department of Planning, Research and Statistics at the Federal Ministry of Health, to be working on scorecards for tracking progress on key indicators. Next slide, please. So just to lay a little bit of background, when we started these discussions with the ministry as well as other government key departments, it was very important to ensure that the indicators and the scorecards on the indicators were linked with the larger national frameworks. And what you see on the slide are the two important frameworks for Nigeria currently. That's our National Strategic Health Development Plan for the 5 years, which is aligned with the National M&E Plan, which kind of shows us very clearly in the country the targets, the indicators that are tracking progress on a larger scale for the health program as a whole. This is also aligned with the global frameworks and what the country has committed to at a global level. We also know that there's a real push in the national framework to have scorecards as well as tracking mechanisms at all levels of healthcare service delivery so that we're able to take informed decisions. Next slide. So what you see right now is an example of the Nigeria National State Reproductive, Maternal, Newborn, Child, Adolescent Health and Nutrition Scorecard. One of the challenges that we were facing in Nigeria is on routine data, on the quality of routine data, on the whole aspect of how much what is the reliability of the routine data, and if we put the routine data on the scorecards, what are we actually seeing? So there was a lot of consultation and discussion with various government agencies as well as partners and stakeholders. And one of the ways we tried to move forward is to actually look at both, to look at the survey data that's available in Nigeria, but at the same time also to be looking at the routine data. Extremely important to have the end users and the people that are entering the data at the facility level for routine data to also be able to use that data. So on the presentation slide is the scorecard for Nigeria, and it's 36 plus 1 states. And what you see are different program elements. There's maternal newborn care, stunting, child mortality, childhood illness, immunization, and nutrition. And this is actually capturing what the survey data is showing for the country. So one can get at a glance look for the different states and where states are struggling or lagging behind. Next slide, please. This is then linked to the next level of data. So this is the scorecard that shows an example of the Nigerian state, which is Bauchi. And we are seeing Bauchi there with all its administrative units, which are called LGAs, the local government authorities. And you can see that on the first column are the names of the LGAs, and on the subsequent columns are key indicators across maternal, newborn, child, adolescent health, and the various diseases. What we've shown here and what we're working with the government to do, and this is really led by the government, particularly the state governments, where Bauchi state government can look at this indicator and see which LGA is scoring red, yellow, green in every quarter. We're also now working with the state to develop trend lines so we can see if a particular indicator has gone up or down, or what is the performance from the previous quarter. Once an LGA scores red on a particular indicator, we are then able to go to the next level of the scorecard, which is the next slide, please. So this is the example of the LGA to the facility scorecard. So we've seen in the last 3 slides, we have a national scorecard with all the states reflected. Then we've got the state scorecard with the LGAs reflected, which is the second administrative unit. And then we have the LGA, that's the local government authority, reflected with its health facilities. So this is the end user kind of health facility data that comes upwards to LGA, to state, to national. This is using routine data, and these scorecards are in turn linked with our national strategic plan and the M&E plan, which is really showing us how we are making progress or lack of progress. An important point here, and what we've seen on the ground with our experiences, is when we see LGAs or facilities scoring red, there's a healthy discussion, there's dialogue as to why we are red. We have an accompanying bottleneck analysis tool that actually is able to list the bottlenecks, and then we're able to prioritize actions, identify the key actions to address these bottlenecks so that that indicator moves along the spectrum of improvement to yellow and green. Next slide, please. And so we've seen over the last, this process has been ongoing over the last 18 months or so, and it started with a few states. Given the experience from those states, it was scaled up to other states and is currently, we've got scorecards for across the country. However, we have about 50% of states in Nigeria, which is approximately 15 states, that are actually doing the scorecards themselves. And at the state level, the state teams developing these scorecards and actually working with them through the routine data. These are also being used at the highest level with governors and the Senate Committee on Health to really get a snapshot view of how the state is performing, which are the LGAs that are actually lagging behind or doing well, and how can we learn from those doing well and take those lessons to the ones not doing that well as support in a much more targeted, focused fashion those LGAs and health facilities that are lagging behind. We have case studies that are now coming up in terms of specific improvement for service outputs, in the quality of care that's being given, and most importantly, the decreasing gap between the survey data and the routine data. So when one can see that the more one uses the routine data on the field, on the ground, the more we are seeing that the survey data findings and the indicator values are coming closer together, which is reflective of the data quality issues using routine data. Next slide. So I'd like to leave you with some next steps that Nigeria is planning now, and that is a basis of the understanding and the learnings. There is a very, very detailed and thorough data quality improvement plan. One of the biggest things of the center stage is the use of data for planning and action, and how do we track that action. There's also work happening in terms of creating shadow scorecards, which are really in-depth program scorecards, which can reflect and give more information on a particular scorecard. There's ongoing work in terms of thinking through on linking the facility scorecard with a community scorecard so that we can get some community buy-in and ownership. We have some case studies that we are putting together, and we are looking at how we can further scale up this across the country with more partners, as well as see what's the bigger scope of this scorecard in terms of resource allocations, and making sure that we are able to really track progress at every level and inform the program back for improving the results overall for children and women. I think that's my last slide, and just acknowledgements to the entire team that helped prepare this, the leadership of the Ministry of Health and NPHCDA, which is our primary healthcare agency, and the state governments that have been extremely, sort of supportive on this and actually excited with the work that's happening on the ground. The African Leaders Malaria Alliance that supported the work in terms of training and capacity building of the state teams. Thank you.
Merci. Merci beaucoup, Sanjana. Je crois que...
Thank you. I think that the Nigeria team will receive a lot of requests for information, maybe also of help from other countries which participate in the GFF partnership, since it was a very interesting example of how to use the data. So we are still, and we are going to see the mapping of resources during the development of the investment case. This mapping, as you know, is a very important step in the preparation of the investment case, since it allows us to determine the available resources, the domestic resource, the government resources and also external resources. It looks at the distribution of resources among intervention or geographically. It identifies the underfinanced priorities. Usually it's nutrition or family planning, which are underfinanced. It allows us to give further priority to these fields. It allows us also to advocate for these priorities. The mapping and the monitoring of resources is also very important when we go over to implementation. So these data are important for preparing the investment case, but also annually they're evaluated at a moment of implementation. They are very important components of the process and allows us, when we have data regarding commitments which were subscribed during the preparation, and it allows us to attribute a reciprocal responsibility to the government, but also to the external partners. It begins with the public sector, the government funds, and we suggest that the countries start with the main sources of financing. Every year you'll get more details and go to smaller sources, but we should not try to catch all the sources at the same time and at the beginning. The letter mentioned, the commitment letter in the GFF process, also defines the expectations regarding data sharing, including financial data. The GFF Secretariat has also developed a tool in order to help in the mapping, and more than one country have used the tools that we have produced. Some countries already had their own, and they have used it also. We also offer technical support in order to facilitate the process. Now, let's see the implementation research. We have to emphasize the importance of this step. There were initiatives before the GFF partnership, but in the financing case, during implementation, we have realized that not enough research was used. That implementation research is critical in order to understand if, why, and how, and in what context some interventions really produce results, while others don't. You have the input, the outcomes, and you have to see what works between input and outcome, and which are the lessons that we can draw from it. It allows us also to better refine the corrective measures which you talk about at the level of the platform. It allows us to also to get more information regarding the real cost of the investment. So you have a budget or budget projections, but at the level of implementation, during implementation, you can make adjustment on the basis of the real costs. It allows a quick feedback, and you won't have to wait for 3 years until the impact evaluation is carried out. Of course, the impact evaluation is important, but we need also quicker feedback loops in order to modify and adjust implementation. It allows us also to inform your workshops or the conferences on outcomes. It allows us globally also to draw the lessons of what countries have done in order to share the data. Of course, some information cannot easily be transferred, while others are very helpful and useful for other countries, and also they're useful to other partners such as UNICEF. Now, a few words regarding technical assistance and how to align it in order to support the implementation. The goal of TA is to maximize the efficiency of resources in order to reach the results which are expected. We have an analytical work to be carried out and a technical support at the level of implementation. At a national level, this mechanism will allow us to obtain technical assistance, and we encourage the countries to define a TA matrix, which starts with an inventory of the needs. Very often, TA starts with the offer of TA, but I think it's more important to start with the needs, a definition of the needs in TA. We know that there are global initiatives which offer technical assistance to the countries. We have to see what is available, what is the link between needs and offers, and see which are the gaps to be filled. And of course, we have to avoid duplication and be efficient. There is also a reference guidelines which will give you information regarding those important TA initiatives and gives a list of the TA sources. And we encourage the stakeholders in the country to periodically review the TA that you have. In some countries, maybe it would be useful to have a subgroup to analyze the technical assistance. It's also possible to cooperate with the national institution, your domestic institutions. The discussion on TA was highly interesting for the national governments we consulted. They mentioned a deep interest in analyzing the regional and national capabilities. Not all countries have the necessary capabilities at their level, so they need to know what's available outside. Let's see what we can do in advocacy. Too often we focus on technical aspects, the packages, the cost, how to implement, and so on. But we forget too often that in order to promote reforms and to maintain or increase the financing, we have, and you have to organize a structured, a well-structured advocacy, which has to be carried out as if it were another project. We have to accelerate and facilitate the achievement of results. The government has to be in the driver's seat, of course. The basis of advocacy is an analysis of political economy in order to develop a short-term and longer-term advocacy plan in order to identify specific actions and to use a national platform in order to implement them. It's one of the ways how we can work in close coordination with the CSO at national and international level, but there are other stakeholders who are very important. Among others, the business leaders, private sector leaders, media, professional associations, parliamentarians, and so on. So it's a kind of a mini strategy in order to reform the training of resources, for instance, which are the measures to be implemented, the decisions which are to be made, and see how we can support the country in order for the country to be able to make the decisions. Communication, which is closely linked to advocacy, of course. The goal is to accelerate and facilitate the achievement of results agreed in the investment case, to create and maintain a common understanding of the approach, of the priorities, and so on within the country, to create also motivation in order to have sustained engagement. The communication activities should be integrated in the implementation. We mentioned it already. It's important also to emphasize the fact that GFAV is a partnership. We don't need branding or to attribute the progress to the GFAV, quite to the contrary. The goal of communication is not to promote the GFF brand or the GFF name. The goal is to mobilize people in order for them to support your priorities. And you are at present in sort of an at-risk period. The countries which started the process earlier show a strong mobilization in order to prepare the investment case, but after that there is sort of a slowing down of momentum. At that level we need to have a very strong communication plan in order to maintain the commitment and in order to get the underlying data which are necessary. In summary, what did I present today? As you already know, GFF is a process in order to manage change that builds an existing system which is led by the countries. I mentioned various strategies, documents, and plans. But what's important is to use what already exists. If you already have a dashboard, don't establish a completely new one. Maybe you can modify the one you have. You have to improve what you already have if necessary. In all countries, as you know, the level of advancing from one stage to the next requires to identify the changes which are needed and to identify the means to advance. We also have to focus on results, outcomes, and going from the investment case preparation and the implementation has been sometimes very hard for some countries, so we have to be proactive at that level. We talked about guidelines also, which make up a framework and are not really requirements to follow stage by stage. The implementation is the main activity, and we have to strengthen all the measures in order to better implement the activities. We encourage you to integrate the various components to have good data regarding results and process in order to take the corrective measures in more than one country, and we heard it regarding Nigeria. The routine data are challenging, but we have to use them together with other sources of data. We should not focus only on technical issues. We need to have strong advocacy and communications. Thank you very much.
Thank you, Luke. I'm sure that was very interesting for many countries. I realized that when I did the round of introductions, I expected that because of the weekend that Afghanistan on Thursday afternoon would not be able to join, but I actually have noticed they're here. So before we go to the questions, I just want to give our colleagues from Afghanistan the opportunity to also introduce themselves and to welcome them. Farzana?
Thank you, Petra. I'm Farzana, liaison officer for Afghanistan, and we have some partners. Maybe they can introduce. I see Rushin in the line from the EU delegations, and also we had the World Bank colleagues with us, WHO, and professional associations for the presentation. Thank you.
Yes. Hello. Can you hear me?
Yes,
no?
we can.
Oh, we can. Yes. Yes. My name's Roshan Rooney. I'm the attaché for health and nutrition in Afghanistan.
Great, thank you. You're very welcome. Thanks for joining us, and thanks to other colleagues from Kabul, because I realize it's late and it's a Thursday afternoon there. So thank you so much for joining. So as we have the whole world connected, it will be interesting to see what questions you have or experiences you may want to share with each other. So I'm going to ask you to take a few minutes within your group to decide on 2 questions or an experience you maybe want to share with others regarding what was presented or other questions you may have. If you can then email these questions to myself and Joy, you see the email address on here, then we will start responding to them as soon as all the questions come in. So we give you about 5 minutes, and then we would like to receive the questions. Thanks. Great. We are ready to start, and there are quite some interesting questions. The first one is about Nigeria. So maybe we can ask colleagues to talk a little bit about this scorecard and how is this organized and supported? What's the M&E unit in the ministry's role in this? What's the relationship between the various partners involved at the central, state and district level when it comes to the use of this data? So maybe we can ask our colleague from UNICEF to comment on that. And then after that, there is a question that I'll ask Luke to answer if some countries have experiences to share regarding the use of civil society organizations to drive resource mobilization through resource tracking. That question comes from Uganda. And the first question on the scorecard comes from Cameroon. So maybe we'll first turn to our UNICEF colleague to elaborate a little bit more on the scorecard.
Sure. Thank you very much for the question from the Cameroon team. And so I'm answering on behalf of the team here who's in the room with me, but also the bigger team that works on this. And basically, this entire piece of scorecard work is led and is housed within the Ministry of Health with the Department of Planning, Research and Statistics. So it's that department that is reflective at the federal level, national level, but also they have their state counterparts that are leading this work at the state level. So it's all within that particular unit of the Ministry of Health. So that's one piece of the question. The second piece is the way it's been done is it's actually a series of capacity building, mentoring, sort of virtual mentoring exercises that is happening. So one set of training or capacity building to be done for all the state focal points along with the national focal points. And then once people have got used to how to develop these scorecards or how to pull the information out from the routine data, the work is almost, the support is virtual. So there's a lot of email, there's a lot of understanding what's going on a remote basis. So that's what was done over the last 18 months to capacitate the state people to develop their own scorecards. And on coming together with partners as well as how it's being used, the real action on the scorecard is really on the ground. It's at the state level, the LGA level, the health facility level. And that's where it should be to make the biggest impact and to get the results. So at the national level, the different partners are engaged. There's, of course, within the UN, the WHO, as well as the other colleagues that work in the development sector. For example, recently there were meetings with the governors, and we had the Bill and Melinda Gates Foundation that was very linked with the scorecards and the work that's happening. So we've got some sort of common understanding and platform at the national level in terms of understanding the work with the scorecards and what's happening. Of course, as in any country, there are many scorecards. So you've got scorecards tracking different programs and things. This particular one that was presented here is focused on the reproductive, maternal, newborn child health and nutrition work. So it's obviously being used in those platforms. The actual work at the state level is where the partners come together. So when you have the state steering committees on child health or the state steering committees on primary health care, that is where the scorecard gets presented, again, by the state planning and research people. So it's not been seen as a partner scorecard. It's a scorecard being used to track progress by the ministry themselves, along with all the partners around the table, and then engaging the LGA committees and then the health facility committees. So we are in different stages of rollout in the different states, and some states moving further ahead than the others, but that brings in the learning and the exchange and makes it all the more richer. So I'm hoping that this helps answer the question, but I'm available in case you need any bilaterals or more info. Thank you.
Thank you very much, Sandana. I'm sure that was very enlightening. I'm actually, instead of asking Luc to respond, I'm going to ask Dr. Jean-Louis from Central African Republic, because he also would like to share some of their experiences on data.
Merci de nous avoir donné la parole pour partager l'expérience dans le cadre de la... Oui, je dis que...
So thank you for giving me the floor. I want to share our experience when it comes to data. We said that this is a coincidence that we're talking about this, because this is we're talking about reviewing all the national indicators, and to validate this list, we took into consideration these indicators. These indicators must be included in the list of national indicators for health, because the country and the Ministry of Health is reforming our health system to have a unified system. So these data will be validated during our work. We established a technical working group that meets once a month to validate the data and to manage all this data. And and put it into our database for healthcare. And we're digitalizing this data. So this is what I wanted to tell you about our country. Thank you very much.
Thank you very much. That's very useful to hear how you are also in this process and looking at the coordination of these indicators and the data and so on. It's very important. I think we also got a comment from a colleague in Afghanistan saying, it's really critical that this data, that this aggregated data at the different levels is very important, but the coordination is very, very critical so that it doesn't have a lot of costs to do all this analysis and the scorecards and implementing this data. So thinking this through very specifically, like you are suggesting from CAR, is very, very critical. So thank you for sharing that. I would like to ask Luc to talk a little bit about resource tracking. And are there some countries that have experiences regarding the use of civil society organizations that have supported resource mobilization through resource tracking? And there's also a question from, that question comes from Uganda, and then there's a question from Rwanda. From Sierra Leone. What support does the Secretariat provide to enable the tracking of GFF resources? And maybe you want to elaborate there of which resources we propose to track beyond GFF Trust Fund.
Thank you very much.
Thank you, Petra. Thank you.
First question of an example. I'll just speak a bit about the Nigeria example that I'm aware of, but there may be others in this webinar who want to also jump in, because we're not always aware of all of those examples. And the one I want to, so in Nigeria, the resource, it's more of an example of a demand for this. And so, the overall systematic resource mapping and tracking has not yet, is just starting. And, but the civil society there, and there are some organizations that are specifically focused on budget execution, public fund utilization, etc., that are extremely keen to obtain the data so that they can use their various networks to amplify the needs and so forth. And so it's just to illustrate that there's, and I think this is the case in other countries too, where there's a very strong demand for this. As I mentioned, there are a number of countries that have been doing resource mapping, well before the GFF, and in many countries not so much. And the same is true for expenditure tracking, which is, so one is mapping the budgets, the intention to invest, and then the expenditure tracking is really focused on how was the money actually used. And that second part is much less developed across the GFF partnership countries. It's a bit more complex to do, as you can well imagine, but there's some countries that are starting. And the civil society organizations are interested in both the mapping to see what are the commitments, and then they usually activate their networks to hold people accountable to, and institutions accountable to their commitments. But they're also very interested to see the expenditure tracking and the governance issues that relate to that and so forth. But there might be others who want to provide examples that are on the line now. And so the question from Sierra Leone was what support is provided from the Secretariat. And as I said, it's support that is, so which resources are we looking at? The resources we're looking at are the domestic resources, as well as those that are aligned to the priorities of the investment case. And I want to emphasize, I think the Nigeria example is a good one there, that the investment case is a tool to help countries prioritize or further prioritize their national plan, their national strategy, etc. And so it's really about tracking the resources that are aligned to that national strategy or that national plan that we're talking about. It is certainly not only the resources that are provided from the GFF Trust Fund or from the World Bank Finance Project that the Trust Fund is linked to. It's the broader set of resources that come from government, from external financiers, where that's applicable, from the private sector, and from the World Bank Finance Project. In a way, the World Bank Finance Project is the easiest for us because we know where the resources are and what the budgets are and what the resource utilization is. But pulling it all together is where the support is. And very concretely, the types of support that we at the Secretariat provide, but as I said, we're not the only ones in this partnership. There are others in some countries that provide support in the area of resource mapping and expenditure tracking. There's the tool that we've developed, which is in the public domain. It's available for anyone to use. There is also often a consultant that's provided to help facilitate the process, at least in the first year, with the full intention that in subsequent years it gradually gets fully integrated into a government department that would do this. What we're finding is that starting right away with saying this is the tool, go ahead and use it, can fall a bit flat, and that partners, particularly external partners, find it hard to be able to provide the data easily. And so if they have someone who sits with them and helps them walk through and align their budget and expenditure categories with the investment case categories, it becomes a lot easier.
Thank you, Luke. And maybe I can just complement from the experiences of both Liberia and Tanzania. So in Liberia, I think I showed the slide that sort of shows the tracking of the different activities. But next to that activity mapping, Liberia also has an annual resource mapping exercise that they have strengthened to now also look more at adding, and we're currently working with supporting the ministry to develop a web-enabled or web-based resource mapping tool that not only looks at the commitments moving forward, but also at what happened with the commitments of the previous year, so that there's really a reporting on what actually has then been spent, as well as what is proposed moving forward. In Tanzania, where they also do a resource mapping exercise, they have just started. They have linked it very clearly to the national health account, which of course looks also at the expenditures. So really there the two are more closely connected, so that the mapping moving forward and the expenditure under the national health account is linked. That works in Tanzania because they actually already do a national health account on an annual basis. In many countries that doesn't happen on an annual basis, so that has been a challenge, but in Tanzania that is the case. And our next webinar is actually on going to be on monitoring resources and results. So we will make sure that we also have some good examples there to share with you in more detail how this is working, because this is a very important aspect we recognize. And I think the point that Luke made, that it is really about looking at the resources of not just the World Bank and the GFF Trust Fund, but all the partners supporting the investment case. And in that case also, if like in Indonesia, where they're currently updating the investment case, the financing of the investment case, the World Bank project is only one part of it. So as they're updating the investment case, Indonesia was asking, do we need to make an adjustment on the World Bank side? So it's important to recognize that that the financing of in Indonesia, IBRD and GFF Trust Fund is only one slice of the investment case. And the investment case is the national program to reduce stunting. And the IBRD bank GFF focuses on strengthening the coordination, accountability, and delivery of this program through DLI. So it's really up to the government to further modify the investment case or the national program to reduce stunting. That should then be used to further guide broader investments. So as you look at the data, you might see that you need to make adjustments in your investment case priorities, right? You may have a strategy like we saw in Liberia, where we just did the midterm review. Some of the strategies that were envisioned to really have an impact didn't have the impact that was expected. So they're now re-looking at what other strategies may need to be taken to make sure that this happens. So this is very important when it comes to taking corrective action based on this data, to decide that you focus on the right priorities or give them enough attention as may be needed. There's a question about, there's two questions. I'm actually going to ask Sierra Leone if they could speak to this. There are two countries that are asking. Madagascar is asking, what are the main challenges experienced by other countries when transitioning from investment case design to implementation? And Guinea is also asking, what are some of the mistakes to avoid when transitioning from design to implementation? I think one of the biggest challenges we have seen is the momentum and the country platform. Because I think when we're designing an investment case, there are certain actors involved, but when it comes to implementation, there may be other actors that may need to be involved to ensure that you get to the monitoring and get the implementation going. And I know Sierra Leone has just gone on reflecting on this process. So maybe I'll ask Stanley and Victor and colleagues from Sierra Leone to comment on that. But before I go to Sierra Leone, I'll get Luc to say a few words.
It's really just to reiterate something we've already said and also presented on. Several countries did not immediately think of doing an implementation plan. They had a great paper that was really prioritized with a results framework and everything, but you can't operationalize that. You have to actually have an operational plan to do that. And so then people went off and did their own things, which are probably all nicely connected, but then the platform didn't have anything to sort of meet on, and it takes a while before the results are achieved. So you have this 1 to 2 year period where you don't actually have the sort of the incentive to meet.
Thanks, Luc. That's very important. So the first step is really making sure that you have these implementation plans and therefore this activity mapping and these type of things that you can monitor. But also making sure you have the right people there to then monitor the implementation. Could I ask our colleagues in Sierra Leone if they would be willing to share from their experiences on this?
Yes. So, okay. Victor, yes. Yeah, Petra. So thank you very much for this opportunity. Yeah. As you may be aware that in the past. The CSOs and a lot of other partners just came in at a point where the country platform, the investment case, so to say, that is the RMNC strategy that was developed. We came in later, but as we speak right now, the government is reviewing the strategy itself, and also a TOR has been developed, whereby it gives the opportunity for a lot of other partners also to come on board, So several meetings are now being held, to ensure that we get the country platform fully functional, and at the same time, other components that has to do with communications as well, because there was not a strategy. There was never a communication strategy, aligned with the RMN state strategy. So also that is being reviewed as we speak right now. And so as CSOs, I think we are fully involved, and a lot of other partners also have gotten to them to make sure they also become part and parcel of the process. So far, that's what is happening on our point here in Sierra Leone, that we want to share currently in terms of progress in the implementation of the RMNC strategy. I think Stanley will also comment a little bit on it. Yeah.
Okay, so thank you very much. I think also from my own part here, what has happened so far in terms of the country platform, implementation of the country platform. Prior to now, the country didn't have a clear understanding of who should be in the country platform, but with the guideline that was provided and the terms of reference that was developed, it was important that we also have the civil society that is here, but also the private sector. The private sector, we are still here to identify people from the private sector or reach out to the private sector, which is quite key in the discussion that we are having as well. One thing that has happened so far is getting the country itself to understand the strategy as an investment case. In this case, what do we need to do, and what is quite revealing in terms of lessons learned is that as it stands now, the ministry, together with the UN partners and the World Bank and the GFF team with other donors, are looking at ways to provide fundings for this midterm review process, which is for the investment case. The government focal person is not in country because he's up in the district attending to another rapid result initiative launch in the district. But they are all part of this understanding that as it stands now, we need to have a clear-cut monitoring framework that we follow, that will be closely aligned with the revision of the investment case. That is, we've scheduled it for the first quarter, and aiming by end of May, the processes would have been completed. One key thing that we've learned so far is in the discussions, there were other existing meetings or other coordination meetings. So the ministry have decided now to collapse everything into the RMNCH Plus country platform, whereby we will have one meeting looking at it broadly, having people from the finance, people from the education sector, agriculture, energy sector, representative being part of that meeting. So, and they've adapted the RMNCH Plus country platform terms of reference, and will be constituting it to have people that will involve in decision making in this meeting. Thank you very much.
Thank you, Stanley and Victor. That's very, very helpful. And I know that Dr. Kenne was not able to join because otherwise he would have also been very keen to speak about this. I know he's a great champion and very well placed to lead this process. There are a few questions about the private sector, Luke. So Uganda's asking, are there some experiences with optimizing the private sector to contribute to the country investment case? And maybe you can speak to that. And maybe if there's any countries on the line who would like to speak to that, can you send us an email so we give you the floor?
Thanks, Petra. In fact, there's a lot of experience, but it's at different levels of depth, if you want, in different countries. And the word contribution also means very different things. And so I'm not sure if what was meant was a financial contribution, but that's only one way in which the private sector can contribute to the achievement of the results. And often it's actually their technical expertise and their ability to innovate that we see emerge quite strongly in several countries. So their contribution to the design of the, doing things differently to accelerate results. And so we see that in a number of cases. One example is when Nigeria developed its investment case, they actually organized a competition to generate innovations from the basically private for-profit or not-profit sector, and ended up awarding 3 prizes that were integrated of innovations that were integrated into the investment case. That's just one example. There are less structured ways in which we see a lot of innovation coming in to address very specific challenges that have actually been developed by the private sector. So that's one. We get a lot of requests from governments and other stakeholders in countries for support on the private sector. And what we find is that not all cases, but in many cases, there hasn't been a comprehensive private sector assessment made. And so that's the first step that we support to help countries think through both what are the opportunities in terms of the challenges they're trying to face that would be amenable to private sector engagement, but also what the size of the market is and what's the potential offer from the private sector. So that's something that many countries are actually doing, and it's sometimes something they haven't thought of doing. But there are cases where that and much more has been done, and this is another opportunity to show how different partners are contributing to this process. The example that comes to mind is Pakistan, where a lot of work has been done at a lot of it financed and supported by USAID to figure out effective ways for the private sector to engage in health. And so they're just at early stages. They recently joined the GFF. They're seeing this as an opportunity to use the investment case to scale up a lot of the innovations that have been discussed with the private sector. If we think in terms of impact and in terms of coverage, the big way in which the private sector is engaged is through service delivery. As we know, all countries have some, and in some countries, a very large percentage of the health facilities that are actually non-governmental. And when we look across the portfolio of GFF partnership countries, there are many that contract in some way or another with private facilities. So that's something we often forget, but actually it's a very big part of the impact, either through performance-based financing of facilities and the internal contracts that exist there, or in some cases, such as Afghanistan and in Nigeria on nutrition, contracting non-state actors through performance-based contracts for delivery of services. That's a very big way in which this happens. The other example or type of example I'd like to talk about is in DRC when they were doing their private sector assessment. This is not the only country example, but it's one that I wanted to illustrate. They wanted to see how they could shape the market for the private sector as a business opportunity to engage with the health sector. I think this is applicable especially in fragile states where there hasn't been as much of a market, and so you come in at earlier days and you can use potentially some of grant financing to reduce the risk of private sector financiers or individuals investing in technologies, equipment, etc., that actually in some other countries is already part of the market, but in some countries isn't yet. And then finally, this is a different form of private sector because it's individual, but I think a very large untapped potential that we're starting to think about is remittances that are coming back from, to your countries. In many countries, they far exceed all of the financing we've been talking about so far. And there's increasingly technologies such as apps and so forth that might help steer some of the financing to system strengthening. A lot of the remittances are provided, as you know, to support families to obtain health services. And there may be some interest in actually also putting a percentage of that into strengthening the systems that provide the services. So that's kind of a range of what I've seen in the portfolio on private sector.
Thank you, Luke. There are some questions around the data collection and the scorecards. Central African Republic is asking, could we provide more details on the scorecard, especially how it functions at central and at decentralized level up to the community level? Also, Ivory Coast is asking, is there technical assistance that supports data collection in social and community structures? And can countries who benefited from this type of TA share their experience? So maybe I'll start a little bit talking about Tanzania, and then I'll also talk a little bit about the RBF at the community level. And then, Luke, you maybe want to complement or maybe maybe Dr. Martina Bey on Cameroon with the community scorecard, maybe you would be willing to share an experience from there. So in many countries, these scorecards, similar to what we heard from Nigeria, are linked to the DHIS2. So the data is already collected, and therefore it's collected at different levels. So the scorecard, and I'm talking particularly about Tanzania, where they actually have incentives or performance payments linked to different levels of the country. So the local government level actually gets paid partly based on performance. So the reporting in the DS2 that then comes into these scorecards is actually used for their payment. And as a result, what we see is that the local government, which is like in other countries would be like a district or a council or a county level, is really using this data for planning purposes because they have an interest to really improve these results because there is a performance incentive linked to it. So the built-in of these scorecards is extrapolated from the DS2, and similar to Nigeria, UNICEF played a very significant role in supporting this. And it really helps to guide everybody's focus. So it's been very helpful. It's actually not been very complicated. Within a year, this was basically up and running. They're actually currently in a workshop, I was speaking to them yesterday, where they're actually looking to make sure that in the actual planning process, this data is integrated. So I saw a question also from one of the countries asking, Burkina Faso asking, how do we integrate this in the planning at the different levels of the health system? How do you include the investment case priorities in there? So in Tanzania, as part of the planning, the look at the data is an integral part. The look at the scorecard and the performance of these scorecards to inform their planning is critical. So there needs to be a link made between the results that they see and the plans that they make. So that's a very important aspect. So apart from what Luc mentioned, the importance of the implementation plan, and we can talk a little bit more about that in a second, the implementation plan is really critical, but the implementation plan is the planning phase. You then need to monitor it and adjust it continuously, right? So in Tanzania, they're doing this by linking the data and the planning very tightly together so that continuously they look, are they on the right track? Are they doing the right thing? And then when it comes to really a decentralized level, at the community level, in most cases when it talks about this type of data collection, it often happens through community health workers or community health volunteers. There are different agents, like in Liberia, for example, it's Last Mile Health that provides support. In Kenya, it's Living Goods. There are different technical assistance agencies that have supported data collection processes through these community health workers. And I know they're particularly also looking at more helping mobile data collection for these type of community structures so that it can be easier analyzed and used and not too complicated to collect. I don't know, Dr. Martina Bey, would you be willing to share something on the community scorecard in Cameroon? Because that might be interesting to hear.
Merci bien.
Thank you. We have not yet implemented those scorecards. We are going to start the implementation very soon. I'll give you an example. the indicator regarding the number of births, of deliveries in hospital or assisted. We are collecting the information at the level of all health sectors. More than 50% of deliveries take place in a sanitary facility. Between 50 and 80% will be in the yellow line, and the rest will be in the green category. But we don't have as such, we don't yet have the scorecards as such. Thank you.
Thank you, Dr. Martina. That's good to know and helpful to hear what your thinking has been in regards to this. It's definitely something that more and more countries are looking at, and very critical aspect to integrate. I'm going to ask, there is a question about from Madagascar. They would like to learn a little bit more how different countries have dealt with prioritization. And maybe I'll ask Luke to speak to this, what the general experiences are, and maybe there's also a country that can share on this experience.
Thanks, Petra. And Madagascar, as some of you may not yet know, is just finishing the preparation of its investment case. So the question is highly relevant still for Madagascar, but it's also highly relevant for all of you who will be implementing, because the investment case is a living document, and you might find that you need to readjust your prioritization as you move forward, either because you've learned some lessons through your implementation research or just to basic implementation, or because new sources of financing have become available or have disappeared. And so you may need to, it's very likely that over the course of the implementation, you'll have to refocus your prioritization. The guidance we're providing now for countries in the new investment case guidelines, which draws on the experience of countries in the first 3 to 4 years, is to think of the investment case as a package of services that are prioritized, and so there's a prioritization process there, and a set of up to 5 reforms that support that delivery, that scale up of that package, or the quality of the delivery of that package. So when you think of it along those lines, in a way it's a lot easier to think about how you prioritize the package. There are a number of tools, instruments, approaches that are available that I'm sure you know, from EQUIST to disease control priorities, etc., that will help you make, based on your burden of disease and so forth, come up with a prioritized package that you can afford. And the affordable part is actually where the resource mapping is so important. What we're finding is that countries almost always have a more ambitious intention, and we're finding that one of the ways in which this process adds value is to put a reality check on what is affordable. And then there's some questions that countries need to ask themselves in terms of, do we go with a wider package and but accept the fact that we will actually have lower coverage? I mean, these are very basic questions, but they are important ones. Or we say we're going to actually be very sharply prioritized in the package and aim to have a higher coverage across the country, including a strong focus on equity, geographic, but also socioeconomic, etc. One aspect of prioritization is also who you are targeting and whether you will start with the hardest to reach or you will assume a trickle down. And we're seeing countries increasingly using their investment case to start with the hardest to reach, because that doesn't automatically happen. There's a lot of reasons why that doesn't happen. So on the package of services, those are the sort of approaches, broadly speaking, that have been taken. As an example, Nigeria, through its Basic Healthcare Provision Fund core package, has actually taken quite a narrow view of the package, but they have articulated in the investment case that there's a phasing process. So they first, and it's over a long period of time, but they've articulated that this package is what they want to scale up nationwide, and then eventually they want to broaden the package. And even the scaling up nationwide is a phased approach. So there's a number of approaches to prioritization. There's the package itself, then there's the phasing of scale up is a prioritized process. There's also the targeting of beneficiaries. How do you prioritize that? And then the point I haven't discussed yet is actually what are the reforms that will support this? And how do you prioritize those? And there it's much less of a, sort of model or tool or instrument that you can use. The way that I see it is you define what you want to achieve, what you want to roll out, and then what needs to be strengthened to actually make it happen. And it's a dialogue in country that integrates a combination of factors. So one is often there have been dialogue for years on issues such as supply chain or human resources for health or data systems. And within those, further prioritizing what are the top reforms or top priorities that will be addressed in the next 5-year period to be able to really achieve the priority objectives that are related to the package. So often countries are choosing to strengthen the real frontline workers. We see that a lot. So as part of their human resources reforms, that's what they see. Or they really focus, they're saying, look, we have some countries that have reasonably high levels of coverage, but not the outcomes they expected. So there's a quality issue, and then really looking at the human resource dimensions of quality, but also the supply chain dimensions of structural quality. And so there's, it's to think through your theory of change carefully and then choose on that basis. But a very important aspect, particularly to the second part, the prioritization of the reforms, is the political economy. And that, at the end of the day, there are methods to use that countries have used to do the analysis, but a lot of it is, consensus building and really thinking it through. And there's a lot of implicit knowledge and tacit knowledge in countries on what would be politically feasible versus not, what might be the windows of opportunities and so forth. So that's what I would say.
Thanks, Luke. I think you also talked during the presentation about advocacy, and I think that's an important part related to that, because addressing the political economy to ensure that these needed reforms actually happen is critical. And CSOs have a very important role to play there. So I definitely think that when you talk about advocacy, you really need to take this into account.
Yeah, and one aspect I forgot to mention, which has been a challenge, and I've mentioned it earlier, but I want to repeat it, is countries have done they've really worked hard on prioritizing interventions, reforms, etc. And then there's still sometimes a struggle, even in countries that have done that prioritization really well, to prioritize the indicators that will be used to track the results. And, it's true that what doesn't get measured often doesn't get done, but also if you have 100 indicators, nothing gets measured. So it's also about really prioritizing that and accepting that it is a subset of what you do, but if you do meet regularly to discuss those, you will be moving forward.
Thank you, Luke. And I think when you explained the prioritization process, you also have implicitly answered Myanmar's question about whether the investment case should be full scale or start as a pilot to show good results. It is also very much country specific. I'm maybe going to end with one question and then we'll go. There are some questions that I think will come up that we will respond to in next webinars. So we will ask you to stay tuned. But this is particularly linked to the implementation plan and really thinking what process is needed to start this implementation plan and linking it to the planning. Do you want to elaborate a little bit more about the different implementation plans and how that aggregates into one plan? And what may exist already, building on what exists.
Yeah, exactly. So it's, as with everything related to this process, really, really want to emphasize that this is not about preparing a document that is, because it says so in the GFF implementation guidelines, we have to prepare a document. And so really want to make that point. And the other related point is that this is about overall strengthening the ability of countries to be able to prioritize actions and track the actions that track the implementation. And so building on what's already there. And so both what's already there in terms of the implementation plans that the various, the reality is that there are often different projects that are supporting the government to deliver its national health strategy. But the dots are not always connected between those different implementation plans and so forth. The dots are often not connected also on resource mapping, but once that happens, you see, all right, are we all in the right areas doing the right things? And that's not about the tracking, but at least you plan collectively and see whether there's adjustments that need to be made. But even, we know implementation doesn't always go exactly as planned, and so to be able to connect the dots between the different plans, and starting obviously with the government's own plan and what government workers are doing and what's being financed by government, and often that includes other sources of financing. Often, for example, the World Bank financing is always on budget, and so that's always at least one, but there's often other sources and sometimes not. And then there's off-budget financing that, and often those are projects or TA initiatives that are acting, but not always with the dots connected. So it's really about pulling those dots together into or pieces of a puzzle into an image, that makes sense. But the pieces, at least in early years, my advice to countries is keeping the pieces distinct may be very practical. And it might be just, there are reasons why these projects work well as projects, but then connecting them as a puzzle is actually, I think, important.
Great. Thank you, Luke. We've come to the end of this session. There are some questions around technical assistance and results-based financing that I suggest we come back to in our future webinars. So I'm showing here the upcoming ones. So we will meet next month to talk about monitoring resources and results. So we will delve deeper into that component that we talked about today. How do countries do this monitoring of resources and results, and particularly bringing this together? And then on the 29th of April, we will talk about coordinated monitoring and implementation, very much linked to also the technical assistance side and the country platform role. And then on June 11, we will have a session on results-based financing. And after that, we will have a session on advocacy. So I would also like to ask the liaison officers particularly if you have good examples to share or experience to share to relate it to these topics, to email me. So if your country says, this is something I really want to speak about or share my experience with, or specific questions you have, please email them so that we can make sure that these webinars are as relevant as possible and really addressing your questions, but also sharing your experiences. It has been delightful to see you all again, to see so many countries connected all across the world, and to see our GFF friends from everywhere. I would like to thank you very, very much for a very productive discussion, and I'm happy to see Ivory Coast mentioned that they are really at the start of the implementation phase, so they felt that this webinar was very relevant with useful examples and good guidelines, and we hope that it is the same for other countries and that you find this useful. Remember, it's advice, and it's really for you to make it as best as possible for your country. Thank you very much, and look forward to seeing you next month. Take care. Bye-bye.
Thank you too. Thank you.
Bye-bye.